Today we are going to fast revise Paget disease of bone. Paget disease of bone. Okay. Now this is also known as osteoarthritis deformans. It is the cellular remodeling and bone deformity of one or many bones. So most common bones involved are pelvis, tibia, femur, lumbar vertebra and skull. Male to female ratio is 3:2 and usual age is more than 55 years. Sign and symptoms of this disease. For the mild cases or early cases, it is usually asymptomatic, so no symptom. Most common symptoms is bone pain, and a patient may have skull bruising that increase head size, loss of hearing of one or both ears, and loss of vision can be there. This is due to the compressiveness of their respective nerves, just like optic nerve and auditory. Associated conditions are osteoarthritis. Why this happens? So we can see here bone is bent here, so remodeling of bone. So mechanical forces is very uneven at joint, so that will lead to mechanical forces, increase mechanical forces that causes degenerative wear. High cardiac output. This is because of the abnormal blood vessels around this bone remodeling. So there are too many blood vessels, or we can say AV shunts. So blood requirement in this specific place is too much, so there will be high cardiac output failure. There is increased incidence of kidney stones, and in the nervous systems, patient can have increased pressure in brain, and the compressing of second, fifth, seventh and eighth cranial nerve, that can lead to their respective cranial nerve palsies. Line faces. This is the one of finding of the line shaped faces of the patient. Genetic causes is due to the mutation of SQSTM1 gene and rank gene. SQSTM1 gene is located on chromosome 5 and rank on chromosome number 6. Viral infection to osteoclast can also may trigger to Paget disease, that is RSV and measles virus. Pathogenesis consists of four stages. First is the osteoclastic activity, that is the osteolysis phase of osteolysis or lytic phase. Mixed phases, where the osteoblast will try to compensate the destruction of osteoclast. Then third phase is the osteoblastic activity, that is osteosclerotic, and the fourth one is the malignant degeneration. So up to 1% of cases can convert into osteosarcoma. Complications. So bone is weakened here, so it may get easily fractured. It can transform into sarcoma, and most common sarcoma is osteosarcomas. Cranial nerve impingement syndrome. Just like if a optic nerve is compressed, then patient can have visual loss, and auditory nerve, if it is compressed, then deafness can happen. lab finding. What are the lab findings? Increase alkaline phosphatase, normal GGT, increase urinary hydroxyproline, normal to increase serum calcium. X-ray findings. X-ray findings are the cotton wool skull, grass blade deformity, blade of grass deformity, that indicates a osteolytic phase. So here is the femur bone, and we can see here the grass like deformity, grass blade like deformity. Ivory vertebra. So lumbar vertebra most common involved here. So we can see this more whitening of lumbar vertebra known as ivory vertebra. Treatment is biphosphonates, most commonly is zoledronic acid and calcitonin. Thank you.